You're gonna feel a nice little arch come straight up, and it's almost like we're meeting my hand to my chest.
Oh! For reals? Because that just... I said I wasn't gonna cry. My depression and my anxiety has really taken a toll. Just the thought of losing my independence with the vision issues.
Yeah.
Can't believe it. Life is just lifing, and you get on a hamster wheel and you never think. Things really need to be taken care of. I mean, you just address them, but you never think things get so bad, but wow.
Yeah.
Reset complete.
There. What's bringing you into the Align Clinic? What's been going on?
So overall ongoing chronic pain, mainly with my eyes affecting my vision, but it is causing some migraines. I have tendonitis in this elbow, so I have had a couple of cortisone, but overall I just have had ongoing chronic issues with my health that is just causing me a lot of migraines.
Yeah.
Posture at work probably doesn't help either.
Okay.
Yeah.
And so how often are you having your migraines?
About 2 to 3 times a week.
Okay. That's a lot.
Yeah, and I do have to take medication, rather not.
Okay. How extensive do they get? Like 0 out of 10, 10 being the worst pain you've ever felt?
Probably 7 or 8. It doesn't quite to a 10, yeah.
It's still pretty high.
Yeah.
That's really high. And then how long do they usually last throughout the day?
It's usually on onset, it gives me kind of like a tingling on the face. Take the medication, it should be gone within a couple of hours, but the medication is absolutely necessary.
Got it. So you have to take it or else you're going to just stay stuck with that. And then like all of this going on, it's also created a lot of inflammation in your eye, correct?
Correct, yeah. So I have the uveitis, which is inflammation of the eye.
Yeah.
But, you know, and then that obviously the vision issues trigger the headaches, but obviously
got it.
Other issues.
And then like we were talking earlier, none of the doctors have really been able to give you an answer as to what's happening there.
I've had quite extensive MRIs. I've had the lumbar puncture. The serious things have been ruled out.
Yeah.
So now we are just looking at, you know, natural things that could be going on.
Yep. A big part of it, right? We were talking about your nervous system, where you always feel like you're just constantly in the state of fight or flight.
Yeah.
Right, your body's always ramped up. It's not able to rest and recover. And when it's stuck like that for so long, right, it's like you're revving the engine the entire time.
Yeah.
Eventually, things are going to start to break down.
Yeah.
Right. So that stress is getting overwhelming for you.
Yeah.
What is this affecting the most for you?
Truth be told, it has. And I said I wasn't gonna cry. My depression and my anxiety has really taken a toll. Just the thought of losing my independence with the vision issues is really stressful. Thank you.
Yeah, of course.
So now I'm just hoping that maybe with some good chiro, we can maybe get some relief and get back on track.
Yeah, and most definitely. And it's like, I understand that because like I experienced it through patients. I've experienced it through myself in the past. And it's like when your body is just in this constant state of stuck, right? Yeah. You can't help but feel anxious or down, right? It just really starts to impact your personality, your lifestyle, your family. Yeah. Everything starts to just bleed into that. And one of the best things that you could do for your body is just make sure that your nervous system is just balanced, right? A lot of times, sometimes the body just gets so stuck in a pattern, you just need that facilitation. Sometimes it just needs a little nudge, right? So you're in the right place. We love working with the nervous system. And I know how much that anxiety and that depression can weigh down on you and your body, right? Mind, body, and spirit. You're going to be taken care of here. Yeah.
I'm excited.
I got
nervous,
you.
But excited.
I got you. And so part of it is, right, we got to work through all the nooks and crannies, get your spine moving better, right? Because this is affecting so much of your quality of life. We want to change that. Let's start here. I'm going to have you let's just take some big breaths. All the way out. So we'll do one more. And out. Nice. Sometimes it can be as simple as just taking some breaths, right? Starts the body off in just the right way. Now, with your neck, there's a lot of jamming up happening, right? You have a reversal, you have a little bit of a bend, you have a lot of compression. And so when we have this zigzagging happening here, that's a lot of stress on your nervous system. So we need to balance that out by creating more fluidity. Let me have you look to the left right now. Okay, so right about here, look to the right. Maybe a little bit more on the right. Were those painful at all?
Not painful.
No, okay. Turn this way, tilt this way, tilt to the right, tilt to the left. Okay. So anything there?
No pain.
No. The other thing too is like you have a lot of flexion in your thoracic spine, which creates a lot of this forward head, anterior head carriage. And this is going to cut off a lot of circulation, oxygen to your brain, right? Because posture is just getting cut off. You can't take an inhale the way that you're supposed to, right?
Yeah.
Do you ever get any shortness of breath?
All the time.
Yeah. Cross your arms. Turn your body. Okay.
Get crunched.
Yeah, crunched. Yeah, those are kind of rough, huh?
Yeah.
Let's do this. I'm gonna have you stand up. You're gonna reach down, touch your toes. Come back up. Got it. Okay, take a seat right there. All right, so movement feels a little rough.
Yeah.
Right.
Just like restricted.
Yeah, yeah. So with the like anxiety, depression, do you have to take anything for that?
Yeah.
Yeah, and that's just, you know, medication, there's always the ups and downs. How long have you been doing that for?
Probably over 20 years.
Wow.
But I just recently, I had a baby 2.5 years ago and I got
Yeah.
off the medication. And I just, maybe about a month ago, things just emotionally just got out of hand. And
It's
then,
got too much.
yeah, about
right?
a month now.
Okay, so the last month has just gotten so much more heightened.
Yeah.
But you've been dealing with it for the last 20 years.
Right.
Wow, okay. That's just quite a bit, right? That's a good chunk of your life that you're just feeling almost like out of your body. Let's see. Let's do this. I want to start by having you go face down. So what we'll do is we'll kind of like match tone, move your body around a bit, put it in good spots. Sometimes what we want to do is we want to just get some balance into the body first. Take a big breath into your hips. Yep, bring it all the way back. Nice. Big breath into here. Good, all the way out. One more here. Try to let your neck kind of expand. There you go. Yes. Last one. Good. Much better movement. With a straight leg, I'm going to have you lift the right leg up as high as you can. Okay. And then down. Lift the left one. Okay. That would look like you got a little stuck there. So when we have a lot of curve like this, we don't want to just push into it because it's going to fight me. So we almost want to do the opposite and open it up. Almost like we're cracking an egg. I'm going to open up your rib cage first. You're going to hug the little pup. Yeah, there you go. Nice. There's a lot of sympathetic innervation in the mid body. So that's a lot more fight or flight response. So if it's constantly stuck, right, you're constantly feeling like you're fighting. So we're just gonna roll you back. I gotcha. Great. So big deep breath in, and then we're gonna let it fall. Thank you. Oh, come back up. All right, nice. Keep taking those breaths. Good. We're gonna keep getting deeper here. You're gonna go all the way back. Fall. Good. I gotcha. Oh, that was good. That was nice. Go all the way back.
Wow.
That second one moved a lot.
That's, you can almost feel like a radiating.
Yeah, like a pulsating, like
Yeah.
it's buzzing. Yeah. Those are all my words, description words. That's how I pictured it in my head.
That's good.
Good. All right. We can take our time, right? Just kind of go through the motions. This one, right? Everybody has this. It's called the Dowanger's hump. It's the CT junction. It's where your neck and mid-back meet. So this one, we're just gonna go through here, get deeper and deeper each time. Through motion. There you go. Nice.
You're definitely right about the breathing.
Yeah, right?
Like a lot deeper already. Yeah. So liberating.
It is. And if you can breathe better, you can calm the nervous system more. That's why like breath work, meditation is so good, because it helps you with rhythm.
Oh, wow. Oh, wow.
Rhythm, look at that, see? Body loves rhythm. Once we find it, then
It's so intense. That's so weird. Oh, wow. You don't even know you need the pops till it happens.
yeah.
I love that. Oh, it feels so good.
Yeah, I'm glad. Well, your body gets into a state of like habits and patterns, right? Sometimes they're bad patterns, and you start to normalize your dis-ease. Not good. We don't want that. Yeah.
You kind of think everything's just life happening, you know?
Yep, like you're going through the motions.
Yeah. The hamster wheel.
Mm-hmm. But then sometimes we just need to get you off the hamster wheel, right? Get you moving in different ways. You're gonna feel a little pressure through the foot here. Oh.
Wow. I didn't know that popped.
Mm-hmm. So I'm doing midfoot here. A little bit more navicular. Sometimes I could do cuboids, but cuboids are mainly on that pole one. That was more.
Yeah.
Bah!
So good.
And if your feet are moving healthier, right, your lower body and upper body are they're just gonna interact with the ground better, right? Because it's like the foundation for your body.
Yeah.
So you don't want things stuck down there, or else it's gonna translate bad all the way up. Is that feeling?
It's feeling
Yeah?
great.
It's feeling relieving?
Yeah.
Nice. I'm glad.
You guys should have sleeping pods.
Sleeping
So after
pods?
this,
Oh, I know.
You should get a little sleeping pod and then
Yeah. Just like a zero chamber, like just to relax and take a nap. I would love to have that. That would be awesome. I'll be in there all the time. Okay, let's get your hips, because the hips don't lie. Okay, so you did have a shorter leg on the left earlier. Yeah, so I'm gonna go this side. So turn face me this way. Usually, when you have a shorter leg, unless you have an anatomical short leg, it's primarily coming from the hips. Because if you have rotation and tilt, what it'll do is it'll like elevate one, because it'll pull the femur head up, and then it'll just mimic a short leg. So that's why we want to take care of the root cause here. Bah! Hold there and there. So this is going to be more of that SI joint here. So through here, I'm going to create a little arch. Most of it comes from the compression, and then I can just kind of pin it with my body, keep the compression, roll, and then drop. Ooh.
I can taste it.
You know, it's funny, yeah, it's like one of like the weird after effects of an adjustment. Like I can taste it too. When I get a really deep cervical adjustment, it's like my taste buds change a little bit.
Okay, then I'll save it for when you do the other neck ones.
Yeah.
That's pretty deep.
Yeah. Turn this way. Okay, so that was, the other side was SI joint. This is gonna be more of your lumbars. We're gonna take your ribs out of the equation, so should feel like it opens up a little bit. Great. So you can just kind of like bookmark it, create a little compression, so that should be enough, and then it's just about speed. Ooh,
Jeez.
that was fun.
Oh, snap, crackle, and pop.
Rice Krispies.
Crispy. Wow.
Making me hungry now. I want cereal. Yeah, you can see better now.
Oh, or at least I feel enlightened. Yeah, I like that. That's
Good. Yeah, because I mean, within the adjustment, we're stimulating the muscle too. Muscle fibers, right? We're so susceptible to vibration and touch. So it just kind of like relieves a lot of the tension that your body holds, on top of getting better input in that area.
What does it feel like? I think it's maybe things starting to communicate, but almost like a tingly.
Yeah.
Feel tingly a little bit?
Like a buzz.
Yeah.
Right? It's that like communication, like reconnect.
Okay.
Sometimes we use like the our safety pin analogy, where if you get a safety pin and you think about it as the communication cycle of your body, right? Sends a signal down, comes back up, and then that's how your body kind of wires itself. When you're stuck, dis-ease, dysfunctional, right? The safety pin's out. So there's this almost like this disconnect.
Yeah.
And then that's where your body starts to separate things. So when you create more fluidity, when you put more relief throughout the body, that safety pin gets put back in, and then that communication circuit is like working better.
Okay.
So then that's how you feel like you can move better, breathe better, just feel more like at ease.
Yeah. We're definitely on the way.
Yeah, that buzzing. That buzzing's a good sign.
We definitely got a buzz.
We got a buzz. Okay, so great movement in your low back, mid back too. Let's get up to your upper body.
Okay.
So we're gonna do your shoulders too, because you spend a lot of time at a desk.
Yeah.
Your shoulders are very rounded forward. Your chest is caved in. So on top of working on the mid back rib cage, right, we can also do more shoulder stuff because this is a little high. See that? It's like they're turned in.
I feel like I'm folded in.
Like you're like, we don't want that. So we'll go here. And this one. So essentially I'm pushing through your clavicle AC joint, and then I'm meeting it halfway with the posterior ribs. And then from here, we just give it a little nudge and some freedom. And we just keep nudging it in the right direction. Yeah. Yes. I want you to take a big breath, and as you breathe out, kind of push and rotate your shoulders back into the table. And then, there you go. One more. And then out. And then out. There you go. Look at that. You want to open the body up.
Yeah.
Feels nice, right?
Yeah.
Sometimes you just need somebody to push your shoulders down.
Every time my husband pull my head.
Yeah. Okay. Ooh, a couple things here. Let's see. Do your headaches start somewhere?
Yeah, here.
They start on the right?
And then I get kind of like a tingling.
There's a couple different things or ways we can take care of this. Different adjustments. We almost want to do we want to do the one that's going to give your body the most input, and then almost reverberate that down through the spine. Definitely a lot going on in your C2 here. You got a combination of like atlas, occiput, but definitely primary occiput on this left. It's just so much heavier on this side. C2 is feeling more like sharp over here on the right. So occiput is shifted over to the left, check. C2 is rotated to the right, check. Typically, you want to start on the segment below, so we'll do your C2. This one we'll do face up, the other one we'll do face seated. Not face seated, seated. This one right here, you're going to feel a little pressure there, right? So upper cervical's main component is rotation, so you naturally already have that here. Just needs a little motion. Oh!
For reals? Is that just...
That was you.
No words.
That was so good.
Wow, that was intense. And freeing.
Ah, there was some doubt there.
Wow, I'm just blown away. Oh. Can't believe it. Feels great.
Yeah. What does that bring up for you? Because I know
it's just like the release.
Yeah. Here.
Just I don't know. You just, like I said, life. You know, life is just lifing, and you get on a hamster wheel, and you never think things really need to be taken care of. I mean, you just address them, but you never think things get so bad. But wow.
Yeah. Just like, it feels like you're tired. Like I can feel it.
Yeah.
It's heavy.
Yeah, very.
Yeah.
That's the word, heavy.
Heavy.
Yeah.
It's been heavy for too long, and you just, like I said, you just need a nudge in the right direction. Your body's intelligent, resilient. It's gotten you here, right? Sometimes it just needs that push.
Yeah. Well, thank you for that push.
Yeah, you're welcome.
Feel free to push me over the ledge.
We got you. Let's continue on that because that was good.
Yeah.
Felt smooth, right?
Yeah.
Yeah.
It felt great.
Good. I'm just kind of letting that integrate a little bit, you know, just let it marinate.
Yeah.
Good. Okay. You ready for the next one?
Oh, yeah.
Yeah. Okay, come up. Yeah, that was clean. That was a fun one. Feels smoother, not as sharp, way easier to move. Now this side. Okay, so this is your there's so much congestion up here. So essentially what I'm going to do is I'm going to take the base of your skull here. We're going to slide it over. So your skull has a bunch of sutures. It's not one bone, right? It's like a bunch just kind of like stuck together. So you can get some slight movement in through those sutures, and sometimes they can get really stuck and rigid, right? You can get like CSF fluid buildup, restricted motion. So what we want is to free that up. So occiput should have this like nice glide, right? But, oh, that's where it doesn't glide. So you see how your body just kind of moves weird? It's like it gets pulled.
Yeah.
As opposed to like when we do a movement that it can move, it all happens just through there.
Yeah.
But laterally, that really pushes you. Yeah, so I'm gonna turn here. We're gonna go right through here. And I got you. Take a nice deep breath. Good. You're gonna feel a nice little arch come straight up, and it's almost like we're meeting my hand to my chest. Oh.
I tasted that one.
Yeah, let it out.
Oh, wow. I felt it. Like, that's great.
You could like almost kind of like feel this like shift, right?
Yeah.
It's such a weird feeling, but it's so good.
It's like, yeah, the head's still there, yeah.
Yeah, it's still there. Check. Yeah.
Wow.
Okay. How did that feel in the moment for you?
It felt good. It was a different kind of crack for sure.
Yep.
It felt like a different movement. But yeah.
Perfect. Big deep breath.
I feel like so tingly.
Yeah.
Wow.
That's that communication, that spark going through, right? Because now your body is just no more state of ease, right? I love it. We've been getting some more laughs, some more smiles, right? Body feels a little bit more like yourself.
Yeah.
Good. We're unlocking your true potential. Let me have you. You're gonna look and turn to the left. Good. Hey. What's up? Look and turn to the right. Oh, yeah. That's so much better.
Yeah.
Let me have you tilt to the left. Ooh, that was fast. Tilt to the right. Yeah, how's that feel?
Good.
Feels good, right?
Yeah.
Okay, good stuff. Look at that. Yeah, doesn't feel as clumpy. Yeah. Ooh. More symmetry. I'm gonna have you go on your back, so face up. So essentially, you have too much pressure into your neck, spinal cord, brainstem. So we need to create a little more space. I'm gonna have you lift your head up and drop your head down. Thank you. So you're just gonna feel a lift like this. It's gonna be a wave. Now I want you to tuck your chin in a little bit. There you go. So we can get a little less extension. Big breath in through the chest. Let it just melt into the table. Let the shoulders drop. Good. Don't hold it here in the traps. Just like let it just fall. Great. And you're just gonna feel a wave come across.
Reset complete.
There you go.
Oh my gosh, you feel that. And you don't even just feel it straight down. I felt it in my hip.
Yeah.
Wow.
It's this long lever axial decompression. It's this unwinding. Definitely a reset button.
Yeah.
Yep. Hold it for 3 seconds. Let it go.
Wow. I really didn't, I've heard the whole I felt it from the top down to my butt, but I really felt it in my lower and then in my hips.
Yeah.
Wow.
Typically goes to the areas where there's the most amount of compression and torsion.
Okay.
And then it's like we're like almost like wringing out a towel.
That's great.
It's cool, huh?
Yeah.
Let's do this. I'm gonna have you sit up. Whoop. And then you're gonna, let's go face down again. All right. Ah, legs are straight. Nice. Aha! They're even. That's cool. Let's do this. Let me have you straight leg again. You're gonna lift the left, then right. Ooh. That looks great. How about the right? Yeah. How does that feel compared to the first time?
Good.
Very smooth, okay? So things feel like they're matching more. Look at that. There's so much more like what we call is we say joint play. A little bit more bounce, a little more fluidity. Good. All right, let me have you sit up. You're gonna face Sophia. Perfect. Let me just have you move your neck around, look up and down, feel it around. How do you feel?
Great.
Yeah?
Yeah.
Stand up and give me a toe touch, please. Let's just see how that, oh. That's pretty smooth.
Yeah.
Okay. I mean, how do you feel overall?
I feel looser. I feel, everyone says aligned, right? I just feel more connected. In my case, more connected.
Connected is a great word.
Yeah.
Because that's essentially what we're trying to do is we're trying to connect everything, like, you know, your body from top to bottom, because oftentimes we separate things too much.
Yeah.
Right. And your body does that as well. And then it creates all this dysfunction.
Yeah.
So what we need to do is we just need to reconnect that cycle, that circuit.
Yeah. Yeah.
Feels good.
Yeah. I feel like my breaths are definitely deeper.
Good.
This is great.
Of course it takes work, but I mean, already it just looks and feels like you're just getting so much out of it.
Yeah.
So it's just about consistency, creating good routines and habits outside of the adjustment, which is just as important, right? Because if we're not teaching you more about how to take care of your body outside of this, then we're not doing our job right.
Let me fix my posture. You just fixed me.
I know, right? That's part of it. Awareness is a big one, right? Because most of the time people are so unaware of what's going on in their bodies. There's that disconnect, right? Now we're reconnecting. That way you have that awareness and you're able to take care of it much better.
Yeah.
So I'm going to give you some recommendations. I'm going to give you some homework. I know homework sucks, but you got to do it. It's going to help.
Okay.
And then we'll create a game plan so that we can keep you feeling better, because this is like the start of you just feeling more like yourself again, especially after heavy anxiety and depression for 20 years, right? You just need some semblance of balance.
Yeah.
Yeah.
Agreed.
Yeah?
Yeah.
You have fun?
Yes, I
Yeah,
did.
you feel better?
Yes.
Good.
Definitely.
I love it. Thanks for coming in.
Thank you.
We really appreciate it.
You enlightened me.
Yeah, high five. Good job.
I feel so good.
Good.